Hey guys, this skill is catheter care, and the items that you're going to need for this skill is a wash basin, some washcloths, a towel to lay on your table to protect your surface, keep it good and clean. You'll need tape to tape the catheter in place on either the thigh or the abdomen. If it's a male, it'll be on the abdomen. If it's a female, it'll be on the thigh. So you'll need those items. You're also going to need gloves and you're going to need a bath blanket. So these are the items that you're going to need, and we'll get started today. Hello, Miss Jones. It's Miss Compton. I'm going to provide catheter care for you. Going to knock, pull my curtain, wash my hands. I want to raise the bed. Again, this is critical. All right, I always like to pull my table close. Again, you would put a towel down to protect your table. And you're going to have a warm pan of water. Set your pan on that. Again, just kind of get organized with your items that you're going to need. Lower the bed rail. We want to put on our bath blanket. Okay, and pull back the covers. The next thing you're going to need is your gloves. Now I like to go ahead and pull my tape. This isn't in your book, but I like to get that ready. And I take a piece of tape and I'll stick it to the edge of the table. Now, your resident may have a catheter strap that they wear, which is fine if they wear that. Another thing I like to do is get my towel ready. Again, just getting prepared. Go ahead and lay that underneath so I can guard the patient. Again, protect them for their privacy. Sorry, I can't talk today. You're going to get your underpad ready. And you're going to turn the resident over, away from you. Put your underpad in place. And gently reach across, and you'll pull the underpad to the other side. Again, make sure that when you turn your resident, you're not turning them on their extremities or anything. Remember, I got my warm water, so we're ready to perform peri-care. If your resident can bend their legs and help you, you can have them to gently flex their knees. But if they cannot, again, some of our residents do not have that ability to do that real well. I'm going to, again, use my towel as a way to guard for the patient's privacy. I like to lay it there. I'm going to need it to dry anyway. And I also have the bath blanket that I can guard them with as well. All right, so you're going to want to, at this point, get your washcloth ready to perform perineal care. Your skills packet says you may verbalize peri-care. So we're going to verbalize that we have performed perineal care. All right, and now we're ready to take care of the catheter. You want to get a small, tiny amount of soap, and you want to open the washcloth. You want to take the catheter tubing, and you want to clean straight down. Then you want to also turn. Do that again. Okay. Someone's call light is going off. I'll be with them in just a second. I'm going to rinse the same way. Okay? I'm going to be gentle. I always hold on to the tubing where it goes into the urethral meatus so that you don't pull on the catheter tubing and cause discomfort or dislodgement of that cath tubing. Okay, you'd have to really pull hard to dislodge it. But, all right, clean straight down about 4 inches. And I'm going to remove the old tape. Okay, and then I'm going to pat that area dry. And I want to, at this point, remove my towel and tape this tubing. This is a female, so I'm going to tape the tubing to her thigh. Again, if it was a male, you would tape it, give enough room and slack on the tubing, and you would tape it to the abdomen. Since this is a female, we're going to tape it to the thigh. And then the next thing we want to do is to coil, and it'll look like just a coil like that. They coil the tubing there to the bed, and you're going to, at this point, remove your underpad. All right. Once I remove the underpad, I can prepare to throw that into the garbage can. All right, and at this point, I need to remove my gloves. Okay, now it's about positioning your resident, getting them covered back up. All right. And you're going to, as always, raise the bed. Side rails. Raise the side rails, lower the bed. And then we're going to lower the side rails. And I'm preparing to go ahead and give her call light. Miss Jones, there's your call light. Again, lower your side rail. Lower your bed. Give them the call light. Then you will report and record. Again, pulling my curtain back and washing my hands. Now I've got to go check that call light.